Hi, I'm Dr. Raymond Zakari, and thanks for coming to my website. I'm going to talk to you today about opioid detox and addiction treatment at home. Often, detox from an opioid takes place in a medical, psychiatric, or freestanding facility, but it can take place in the comfort of your own home. Many patients find that much more comfortable. The substance that you need to detox from determines how long the process can take. But in general, an opioid detox takes about 5 to 7 days. I'm going to go through this presentation and help you learn a little more about what to expect during a detox process, as well as the addiction maintenance process afterwards. So first, we're going to get you through the detox, and then we'll talk about how you can maintain your sobriety. Detoxing from opioids can include things such as narcotics, morphine, oxycodone, fentanyl, heroin, and related medications such as tramadol. Your symptoms need to be monitored using a validated tool to decide if you're in withdrawal. Withdrawal is the thing that tends to scare most people from trying to get sober. Withdrawal is the period between the time when you are between using, when you start to experience physical discomfort and you start to crave using again. This can be quantified on a scale, and when you start to feel uncomfortable, there are medications that you can get to help you be more comfortable as the substance naturally washes out of your body. These are some symptoms of opioid withdrawal. They include racing heart, sweating, restlessness. Your pupils may dilate, or you may just be bothered by the light. You may have some bone joint aches, runny nose, watery eyes, nausea or vomiting, tremor, yawning, goosebumps. You may become more irritable or anxious. These are the common symptoms of opioid withdrawal, and when you experience them together, they yield a score. That score, when it gets to be 10, qualifies you to try some of these medications to make you comfortable and ease you through the detox process to sobriety. When your score becomes 10 on the COWS scale, you can either use Suboxone, a bridge device, which is an electronic device behind your ear, which counteracts the symptoms you may be feeling, and or supportive medications and behaviors. These are things that you can take that will also ease your discomfort during the detox process. The most common known is Suboxone. Suboxone is a medication that binds to your opioid receptor to relieve the distress that you're feeling. Not everyone chooses to do this. And you have many options when deciding if you want to do Suboxone for detox only, or do you want to stay on Suboxone for sobriety maintenance. You have other options, including supportive medications, which target some of the symptoms you may feel, but the main symptom to target is going to be sleep. Sleep will increase your ability to tolerate distress, which is often greatly reduced in someone that's been using opioids for a period of time. Once you get through the detox period, then the next thing will be to find a support group, individual therapy. Some patients opt for an intensive inpatient rehab, while others want to go away longer term for residential rehab. And yet others still decide they want to continue in their lives, but they want to do outpatient rehab. All of these are viable options, but in order to approach any of these, sobriety has to come first. There is this option of Vivitrol, also known as Naltrexone, which is a long-acting injectable. This you get once a month, and the goal of this is to block the effects of opioids in your system. This is a good way to provide a chemical babysitter in the system. Just in case you use again, it blocks the effect, so you don't get the reward feedback, which is what creates the incentive to keep using. You have to be careful, though, because likely you've been using for some time, your tolerance has gone up. That tolerance will come back down, which is a sign of your body returning to normal. The problem is you can easily overdose if you start using again after a detox or a period of sobriety, because your tolerance level goes down over time. Vivitrol also can be used to reduce the reward feedback system associated with alcoholism. You may also use supportive medications in conjunction with Vivitrol aimed at treating underlying conditions that have yet to be diagnosed. Some questions to consider before you begin the detox process is, why do you want to detox now? Having a significant why can often give you the psychological stamina to get through this difficult period. The other question to consider is, do you want to try Suboxone? Suboxone can be used to get you through the initial detox period, and then you can be done in 2 to 3 days. Some people decide they'd like to stay on the Suboxone long term. You should know that we don't really have a good way to get you off of Suboxone. Something that people have started using is the bridge device. This device can be applied in people trying to come off of Suboxone or opioids as a means of becoming chemical free in the long term. Another option to consider is supportive medications. These medicines can be aimed at treating depression, anxiety, goosebumps, chills, sweats, diarrhea, nausea. These symptoms do go away over time, and you can have medications to help reduce their intensity so that you're able to function more fully. The other question to consider is, are you looking to detox from Suboxone? The same supportive medications will be used, but maybe you'll consider using the bridge device as a means of reducing any discomfort you may have. And then early on, you need to decide if you want to try Vivitrol. This can be given on day 7 after opioid detox. This requires some ordering, and it takes some time to get, as it can be quite costly. But Vivitrol is a viable option that allows you a degree of freedom as you maintain your sobriety. Opioid detox can be done at home or in a hotel, and it can be safely done. You do require a friend, family member, sober coach, or nurse to be with you, as you cannot do this alone, and it requires a willingness on your part. The process takes about 5 to 7 days, and medications can be used to promote comfort and sleep during the detox process. When you're ready to request an appointment, go to metromedicaldirect.com.